Hello, and welcome to Module 1, Chapter 1, Major Characteristics of U.S. Healthcare Delivery in 6009, Nursing Leadership and Organizational Systems. In this module, we will be reviewing the AONL, the American Organization of Nurse Leaders Competencies. So the AONL is committed to developing and disseminating these core competencies for nurse leaders in a variety of settings and a variety of different level of responsibilities. So the AONL Nurse Leader Competencies provide a framework for knowledge, skills, and abilities that are associated with effective leadership, from first-time leaders to experienced executives. And we hope at Marquette that you see that you are a leader no matter what seat you lead from, as soon as you graduate from our program, and probably before it as well. So the AONL characteristics and competencies of leadership are from these spheres: professionalism, communication, relationship management, business skills and principles, and knowledge of the healthcare environment, all put together to develop the leader that is within all of you. The Maxwell's 21 Qualities of a Leader book that you will be reading throughout the semester go over all of these different qualities: servanthood, self-discipline, vision, security, courage, listening, generosity, a positive attitude, commitment, competence, discernment, teachability, charisma, communication, passion, character, focus, initiative, problem solving, and relationships. So we hope that you will find throughout the semester reading 2 or 3 of these qualities per week, that you will see how you can use these qualities throughout your time as a nurse. So getting back to Chapter 1 and Module 1 of the Diane Singh textbook, Essentials of the U.S. Healthcare System. What are we going to review and read about this module? So it is an introduction that the U.S. healthcare system is a complex and massive system. So healthcare delivery, just thinking about it, it's what are the major components of the system? What are the processes that enable people to receive healthcare and the provision of healthcare services to patients? Subsystems of the U.S. healthcare delivery, you're going to think about managed care, military care, integrated systems, subsystems for different populations, long-term care delivery for people that have needs for long-term care, public health system, and patient advocacy organizations. In managed care, thinking about it is the dominant healthcare delivery system of the United States, and it is available to most Americans. Employers and government are the primary financiers. And then managed care organization functions like an insurance company, where it promises to provide healthcare services as a contract under the health plan to the enrollees of that plan. An enrollee, I'm sure you're all familiar, is just an individual that is covered under this plan. And it includes in that plan a list of covered health services. The selected providers are usually the primary care practitioners, which are like the gatekeepers. Managed care does try to achieve efficiencies by integrating basic functions of healthcare delivery, kind of to manage the utilization of medical services. The managed care determines the price at which the services are purchased and how much the providers get paid. I love this visual. It really helps looking at that for me as a visual learner, but looking at managed care and how those functions are all integrated between the financing, the insurance companies, the delivery, the providers. Pens up, if you have had me before, you know that I like to say pens up for things. Throughout this text and throughout this semester, I do want to have you pay attention to, at times, the lack of nursing mentioned in leadership. So here it has providers, physicians, but then it doesn't list advanced practice, nurses, or even PAs, just goes to hospitals. So this is a problem, we know, but we are going to continue to use this text, highlighting it and make you aware of where nursing is left out of decision-making and leadership. And then also in this visual, the payment, risk underwriting, and utilization controls. Also thinking about the military care system. It's for active duty military personnel in the U.S. and certain uninformed non-military services, such as public health services. And it's very well organized and highly integrated and offers comprehensive services, preventative and treatment-oriented. It's called TRICARE, financed by the military, and the VA healthcare system is available to retired veterans, and it focuses more on hospital, mental health, long-term care. It's one of the largest and the oldest systems from 1946. Then you have Medicare and Medicaid. So Medicare is one of the largest sources of public health insurance in the United States. Serves the elderly, disabled, and those with end-stage renal disease. Medicaid, on the other hand, is the third largest source of health insurance in the United States, which provides coverage for low-income adults, children, elderly, and disabled. And then children's health insurance is the CHIP program, which provides insurance to children in uninsured families. Thinking of public health as a system, it is in place to monitor health status to identify and solve community health problems, like we had with the pandemic, with COVID-19. It is to diagnose and investigate health problems and hazards, to inform, educate, and empower people about health problems, to get communities together to identify and to solve health problems, and to develop policies to support individuals and communities. It enforces laws, regulations to protect health and safety, provides people with access, assures a competent professional health workforce. It's also in place to evaluate the effectiveness, accessibility, and quality of personal and population-based health services. It's also there to do research, to discover innovative solutions to health problems. And then lastly, healthcare reform. The Affordable Care Act. 41 million uninsured Americans were in 2013. But by 2019, there were only 29.3 million uninsured Americans. So it increased coverage, improved access, and financial security, and economically benefited states and providers. In the United States, there is a drive to use primary care as the organizing hub for continuous and coordinated health services with seamless delivery. Legal risk. What legal risk is there, and how does that influence providers' practice behavior? Well, as you know, because Americans can be quick to file lawsuits, there are some healthcare providers that practice defensive medicine, which means they take extra precautions, such as prescribing additional tests that they may not have ordered, or scheduling extra appointments, or abundance of documentation on cases to cover themselves in case of a lawsuit. This does end up contributing to increased health expenditures. Exhibit 1.1 is really good, kind of putting all of these main characteristics of the healthcare system together. And you can read over those. So to end, I'd like to remind you, Marquette MSN students, that will soon be our next generation of nurses, that you are leaders, no matter what seat you lead from. Some students and graduates will think, well, I'm not a CNO, I'm not a chief nurse officer or executive, I'm not a charge nurse, I'm not a supervisor, I'm not a leader. No, you are a leader. You will be looked to from other nurses and from patients and families because you have the qualities of the Marquette nurse. So you are a leader. So hopefully you see that, you develop those qualities, and you will continue to make us proud no matter what seat you lead from. Thanks so much.